What's up, guys? John here. Titan Talk Tuesday. We are in full effect. So, guys, it's been a crazy Tuesday for me. I don't know if you guys have been following the Facebook or Instagram stories, but today is officially my son's 10th birthday, right? So, I mean, of course, me and Sharice have been working through the day, and she's right here.
I'll join today.
Yeah, that's awesome. She's gonna join today. Oh,
Special
wow. I feel this is. I didn't know this was gonna happen. So,
Hi.
hey, this is great. So anyway, so this is awesome. I mean, it was his 10th birthday today. So of course we worked all day. We got up, we worked. He had friends that came over 8 o'clock this morning, so it's been an all day event with them too as well. So what we did today is we went to this place called Altitude. We did jumping trampoline, dodgeball on these trampolines, really, really cool stuff. Went to Dave and Buster's, did all that. But if you see on the story, you see me sweating. So I did a whole bunch of cardio today. It's like the only cardio I ever do, except for with my wife. But at that point, jumping on there definitely, got me going, got the heart racing, got me sweating really, really good. It got a really good sweat. So getting cardiovascular, you're having fun. It's doing a good, clean activity. And that's what it's really all about. It's finding those good, clean activities you have fun with that your family or any of your other people that you're having loved ones with. And at that point, you'll enjoy it, man. And you'll get through it real quick and you won't even think about it. Some people, they dread cardio or doing stuff like anaerobic exercises, and at that point you really shouldn't dread it. It's really helping you and helping your heart and cardiovascular. So big ups to that for my son today. Big happy 10th birthday to him, and thank you for everybody that's wished him happy birthday out there, from Titan supporters to friends to family. I appreciate it. Sharice appreciates it, and the whole Titan family out there, we appreciate it, because our kids are our future, and teaching them is definitely the way to be. So teach them right, give them the morals, give them the ethics, give them the values, give them respect. A lot of these kids don't have that these days. I'm just being honest out there. They don't open doors for people. They don't say thank you. They don't use any of these things, and they should. They should really respect their elders. They really don't know, and that's because they haven't been taught properly, I think. So at that point, discipline your kids. Make sure you're telling them the right way. Don't be scared to tell them the wrong way is wrong, and the right way it should be, even if it goes against what they think is cool, right? Because it's not cool to be wrong. So, that was another thing. So, all right, let's get into some Titan talk, right? We got to get some Titan talk. So, the big news, I guess, the big thing that I'm going to throw out there that you guys would be interested in is our summer packages, right? So, that's the big news. Last year, they were a big hit. So, we decided, you know what? It's time to bring them back. So, what we wanted to do is we wanted to bring them back to you. And we wanted to help you guys out for the summer. Tighten up, get right, stay tight, look good, feel good, and perform better. So at that point, we got 3 packages for you guys, and it's going to save you guys money on these packages. And it incorporates a number of different therapies. So let's go through these packages, and then we'll talk about the benefits of these packages and how they'll help you with your summer body and to help you tighten up. So at that point, we have the first summer package, and I released these on Instagram. Yesterday was the first one released. Today was the second one. Tomorrow will be the third one I release on there. But they are offered now currently, so current patients can take advantage of it and new patients coming on. So the first package is, so we have our Tighten Up, which is our injectable therapy, which has fat burning properties in there. It helps you process fat to the liver faster, natural energy, great injection for a lot of different purposes. At that point, that's one way that we're going to start really targeting your metabolism to help it start racing and start burning that fat. 2, we're going to have the fat loss cream. So you're going to be able to apply this to the areas, maybe specific areas that you're having trouble with. These troubled areas, you can apply it to these areas and it should work. Now, that is not a fat burning cream as far as you're going to apply it and you're going to burn fat through the layers. It's not going to happen like that. What's going to happen is it's going to help shrink the fat cells in there to make sure the skin is tighter. You're having a more aesthetic looking appearance and area. So you can release on a number of different areas. Females and males both use it. So it's really, really good. I get a lot of feedback. A lot of people use it on the abdominal area. I haven't really used it on there. I really don't need to. But I have heard, a lot of competitors use it to get that little bit off. Or I have a lot of regular people that are starting to use it in these areas. And they can use cellophane or they can use a screen, because a lot of people have screens out there anyway, and you can apply it and use the screen. You can use it during workouts. You can have it during, you know, you can use it overnight, I guess.
Honestly, guys, I definitely have to jump in on this one because I am a big fan of the fat burning cream.
Okay.
The reason why I'm a big fan of fat burning cream.
Move to the right, Trees.
This right?
Yeah, you're good on Instagram. Sorry, Instagram.
Okay.
We were in the home studio.
I don't know how this thing works.
And at that point, we are doing this live from home studio. So,
so the fat burning cream, I actually like it a lot. Okay, I do use it in my abdominal region, and I'll wrap it up and stuff like that. But I also use it on. He asked me to go this way, babe. Go to the right. I know it looks weird here, but he's like asking me.
Gotcha.
Yeah. All right. Moving on. Like I said, I like the fat burning cream. All right. The reason why I like the fat burning cream is not just for the abdominal region, but it's also for a couple different troubled areas that I know that females in particular have. I'm going to mention the back of the thighs. The back of the thighs, you know, you might be going to the pool or you're wearing some short shorts, or even if you're not wearing short shorts and you're wearing a skirt or whatever it is that you're wearing, a jumpsuit, whatever, and you got these little tiny baby ripples in the back of your thighs because you did not drink enough water or you ate pizza or whatever it is that you did. You know, you didn't do cardio that week. It actually does tighten the skin in that area. Now, it is a short-term fix. It's not going to be like your forever fix. When you put this on there, it's going to disappear, because that's not how that works. I mean, that would be that we have magic, and we don't have magic, or I wouldn't be standing here right now. So with that being said, I do like using it on the back of my thighs on the days that I'm having a bad day. Now, back of the thighs aren't the only place you can use it. You can also use it, this is for guys and girls, you can use it on your arms. We have some of our people that they take it and they actually wrap their arms when they're going, even if you're not going to train. I have had some people wrap themselves to go to bed.
Yeah.
To go to sleep in. Whoa. So it's been, I mean, I'm a huge fan. Me personally, this particular type, these packages are probably my favorite to talk about because I take it.
Yes.
Yeah, because I do take them. So I do like the fat burning cream. I enjoy the Tighten Up. It's a great injection. It's virtually painless. And then to talk about my ECAs, I wouldn't give up my ECAs if you paid me.
Yep. So ECAs are the third part of the first package. So let me just go over the first package we do again. You'll have your Tighten Up Injectable Therapy, which is going to target the fat burning properties, boosting metabolism, natural energy. So that's one route we're going to go in that package. The second package is your fat loss cream. So you can target specific areas with a topical therapy to target those areas and help burn fat or tighten the areas or make it look aesthetically better. The third part of this is your oral version. It's the Eca Stack. So the Eca Stack, we want to make sure, you know, because people are sensitive to caffeine, ephedrine. We want to make sure that there's the right dose for them. So low dose or high dose, it doesn't matter. The ECA Ultras are not on this, but the low dose or high dose are there for you. And at that point, that will be the summer package. So that will be your Tighten Up, your fat loss cream, and your ECAs. That's summer package number 1. And that package is $400, okay? And that's for all 3 therapies. You're getting a lot of discount there and a lot of bang for your buck. You'll be able to target all 3 areas or all 3 things as far as what you want to do, the routes that you want to go. That's package 1. Package number 2, right, is your Tighten Up and your fat loss cream. So you can use your injectable therapy or your Tighten Up, and you can use your fat loss cream to target the areas as well. So that's a 2-way route that you can do. Your third package is a pick 2, but the caveat to that is you need to take the ECAs. So the ECAs will be there, and you can either pick the fat loss cream or Tighten Up. That package is $220. That's your third package. So package number 1, ECAs, fat loss cream, Tighten Up, all 3 therapies, $400. Package number 2, fat loss cream, Tighten Up. That's $300. That's package number 2. Package number 3, you have to pick ECAs with either fat loss cream or Tighten Up, and that's $220. So guys, if you know our regular prices, you guys will see that you guys are getting a lot of bang for the buck and you guys are getting discounts. This are summer packages for you. Take advantage of them. They will help tighten you up, right?
All the way across the board.
They'll make you feel better. So at that point, use them right. These are tools for you guys. They're not magic pills or creams or injectables that are just going to magically make you look thin or aesthetically nice. You have to work for it a little bit. You're going to have to diet a little bit, right? Sleep a little bit and take your Tighten therapies. Now, when I say this, it's big to be consistent. You want to be consistent with whatever you do. In life, this is key. Consistency is key, and more of a positive consistency, not negative. Because you can get a negative route too, and at that point, you're just doing negative things all over, and you're just following that path. Make sure it's a positive path and go forward. So at that point, I'll go over the testosterone replacement therapy in 1 second. So at that point, use these things as tools. Let them expedite the results for you and help you feel better, okay? So at that point, I really want you guys to get the best bang for your buck. Summer packages, go over these summer packages, and we'll get to it. All right, so the next thing I want to talk about, and Sharice, I'm glad you're joining me for this because I didn't plan for this.
Yeah, hello.
So we're going to talk about aromatase inhibitors.
Oh boy, my favorite thing.
So we get a lot of comments about aromatase inhibitors. I see a lot of things on the internet about aromatase inhibitors, and I'll go over what an aromatase inhibitor is. So aromatase inhibitor is just what that is. It's supposed to stop the conversion or aromatization of one hormone to the next, right? And usually that's testosterone to DHT or estrogen, and that's what I'm talking about specifically here. So at that point, when we talk about aromatase inhibitors, some people, their body is naturally sensitive to estrogen. And at that point, they are very sensitive and it's very high. Females in general, right? Males, they get pre-puberty gynecomastia. You were a candidate. You were estrogen sensitive, most likely. Or something has caused that gynecomastia.
Or, let's not forget, sometimes your ethnicity has a lot to do with it too, because I do know, and this is a fact, I am Indian, so I can tell you, Indian people, they do have high estrogen levels.
True.
So it's true. It's a true statement.
Now, that could be from diet, that could be genetics, that could be a lot of different things. So you want to look at these different things, right? But, so we go back to aromatase inhibitors. So I covered what an aromatase inhibitor is. Now, what is FDA approved for? What is an aromatase inhibitor FDA approved for? So a aromatase inhibitor is FDA approved for pre and post breast cancer patients, right? So at that point, why? Why are they getting prescribed this? They're getting prescribed this because their estrogen levels were probably very high, and in the cancer, it could have came back, right? With these things or cancer cells being estrogen, right?
It's E2 receptor positive is what it really comes back to. And a lot of these people, in my particular situation, which I'm a good person to talk about it, both of sides of my family, my mom and my dad's side, pretty much everybody on both sides, both grandmas, the whole nine, everybody has had breast cancer.
Right.
My mom, luckily, knock on wood, has not, okay? But that doesn't skip me, okay? And so I just so happened to end up in that category with high estrogen levels. Now, thankfully, thank goodness, we opened this company, because if we never opened up Titan Medical Center, I more than likely would have never, ever, ever checked my estrogen levels, because no doctor has ever told me to do it, even though they knew my history, even though I've had endometriosis since I was 15, even though I've had 4 or 5 surgeries, I've had a laparoscopy, a surgical, going in, taking out all the scar tissue every 2 years. Yeah. Nobody's ever told me to check my estrogen levels. So let me tell you something. And in all honesty, taking an estrogen blocker literally changed my life.
Yeah.
It did. It really changed my life. So, I mean, as far as when it comes to what it's FDA approved for, it should be used as a preventative for people that are in the bracket of possibly having breast cancer, because high estrogen levels can lead to cancer, period. Whether it's breast cancer, cervical cancer, ovarian cancer, any type of cancer. It does increase your chances of getting cancer.
Absolutely.
It's a fact.
Absolutely. So we know this. That is a fact. So at that point, aromatase inhibitors. Now, there's a lot of different aromatase inhibitors out there, okay? And there's a lot of different things and stages of what these drugs do and what they've came across. So the first one was tamoxifen, right? Tamoxifen specifically targets the breast receptors, right, for estrogen. So at that point, as far as side effects, you can still get water retention, you still get irritability and all this stuff. So you can still be bloated, right? Now, you might not get gynecomastia, and a lot of guys, they're like, well, I don't want to take an aromatase inhibitor until I get symptoms. Guys, that is way too late for you guys. That means that you've already got the negative side effects coming. Now, can you stop them in time? Is your body going to stop that process and go back? Now you go on to the next aromatase inhibitor, anastrozole. So that's a Remedex for people out there. That's a manufacturer name. But anastrozole, that's the main ingredient. So anastrozole, the aromatase inhibitor, is the most commonly used one. And that's what we use mostly here at Titan Medical Center. And that's for males and females, depending on your blood work, right? It's not something, I need to lose weight, I'm going to take an aromatase inhibitor. It doesn't work like that. right? So at that point, this aromatase inhibitor is very good for males and females. There's more as you go up because people need other drugs because everybody's different. And one aromatase inhibitor might not work for somebody, or somebody might need an increase in dose or something that's stronger. Now, then you go on to letrozole, which is a suicidal aromatase inhibitor. That means it kills estrogen. Buying estrogen. So at that point, you better have a lot of estrogen. You better be very high or very estrogen sensitive. And there are people out there that need this medication. That's why it was developed. And there are a couple of people in the practice that do use it through us, right? But everything comes down to the blood test, how you feel, how's everything going. The next one is exemestane, all right? So
It's a newer one, right?
That's a newer one, and at that point, it's been a very, very good option for some of our patients.
Yeah, it has been.
It's worked very well for some patients that couldn't get dialed in, right? And there's two real main blood tests that you test for estrogen or E2 estradiol for males. For females, there's a couple other ones. Total estrogen, estrone, there's a couple different ones. But for males, specifically the E2, there's estradiol or estradiol sensitive. You don't want to run the estradiol sensitive right away. I don't think you need to. That's just me. Now, some doctors might disagree or might want to run that right away on you. That's okay too, right? It's going to give you a reading. And you can go off that reading. Or an estradiol. Now, the estradiol is up and down. You're all over the place. You don't feel right. You just can't dial it in. Then maybe the estradiol sensitive is the way to go. At that point, you will know exactly where it's at, or your doctor should, and they should know where you're at. Now, the other question is why do you use it with testosterone? Now, I covered this in the beginning with the aromatization of testosterone into estrogen or DHT. So at that point, you don't want it to aromatize into these things. When aromatizing these things and you have high estrogen, like Shreese said about the cancer and all that stuff, let's talk about the immediate side effects if you get up. Water retention, irritability, possible gynecomastia, right? So you'll be short fused. The term roid rage doesn't come from high levels of testosterone.
So glad you mentioned that.
It happens because of high estrogen levels.
Yep.
So at that point, I love you women out there, but think of your women, all right? Or guys, think of your wife or girlfriend, whatever it may be, and think of that special time of month.
Rare.
Right, that special time of month. Hormones, that's why they say hormones are fluctuating, because estrogen's usually high, and that's why they have water retention, bloating. They're they're irritable. They want to eat a lot.
We might be crying over something. Maybe you talked too fast on the phone, and it made us feel sad, and we started crying immediately.
Yeah. So I mean, you guys watch out for that. So it's the same thing with guys.
Yep.
If their estrogen levels go real high, they're crying over commercials or movies that they normally wouldn't, or being very sensitive to things that they normally wouldn't. It can also cause mental things. Fogginess, right? Or mental clarity, or being paranoid.
Memory.
These things go along with your hormones, and everything is abided by and adjusted by your hormones. So you got to have a balance. That's another thing I want to talk about here is balance. So balance of the hormones is key. And when I talk about balance, I don't talk about this. I heard one person, they'll come to us, so my testosterone is 1,000, so my estrogen should be this percentage of it and be higher than the range. No, it should be within range, okay? No matter what your testosterone level is, 5,000, 10,000, 2,000, 1,000, 500, whatever it may be. It needs to be in that range, right? And your estradiol should be in that range of what's on the lab, reference ranges.
Right.
So at that point, you're going by that. Not a multiplier or anything like that. Please stay away from that, and that's just my opinion. Like I said, if your physician says something different, go along with them if you trust them. That's all up to you.
You have to remember, guys, that every lab has different interval ranges. Now, like John said a few minutes ago, everybody's different. This is not a cookie cutter type of thing. So everybody's different. You can have, I'm going to give you a perfect example. I've been doing this a long time, so now I can talk about it, and I speak about it very confidently. So here's the deal. You can have a guy that comes in, and he's 5'10", he's 200 pounds. You got and he's 35, okay? You got the next guy come in, he's 45, 5'10", 210 pounds. You got another guy come in, and they're all the same exact height, weight, maybe a fluctuation in age. But one guy, let's just say, for instance, your estrogen panel, let's say that interval range is from, I'm going to give you just an example, from 10 to 40, okay? You got one guy that comes in, his reading comes back at a 12. And he says, hey, doc, I feel amazing. My libido is great. I have no erection issues. My mood is on point. Me and my wife are getting along. Everything's fantastic. I'm doing great at my job. Awesome. You got the next guy that comes in. He comes back, and they're all on the same exact dosage of everything, okay? He comes back, and he's at, let's say it's 25. he might be happy at a 25. That might be his number for where he needs to be. And all these guys, we're not going by weight. We're not going by height. We're not even going by age, guys. We're going by how you feel, what your values are at, and what's going on with you specifically. So make sure that when you're talking to your doctor, even if you're not coming to Titan Medical Center, make sure that when you're talking to them, that they're not that you're telling them what's going on. You need to let them ask you what's going on. Because if they don't ask you what's going on, there's a problem. Let that be a red flag for you.
So I want to answer this question because I have heard this a lot, and I know this has been out there. So Jay Sunisa 31. So you said you found a guy online. I know who it is. I'm not going to say his name on here. And he says he's against aromatase inhibitors. Dr. J. And at that point, listen, he thinks his way. I'm telling you, our doctors think our way. There's plenty of studies out there as far as high estrogen. We know why aromatase inhibitors are made because of breast cancer patients. That runs the exact same risk as males, okay? Number two is think about it. If you're going to get the symptoms from high estrogen, why not use an aromatase inhibitor? We know this, right? So at that point, that's where I really... And
I gotta interject on this.
He knows his stuff.
I gotta interject on this, guys. I'm gonna definitely interject here.
Sorry, guys.
So, guys, I have been in the medical field, okay? I'm going on, 12 years, 13 years, something ridiculous, okay? I've been in the medical field for a long time, and I have worked with hundreds of doctors. Hundreds. Not 5, not 6, not 20, not 40, hundreds, okay? And plenty of them in every different specialty. Now, I want you to remember, you can go to Dr. A, B, C, and D and ask them all the same question, and they tell you 4 different answers because everybody thinks differently. Maybe one was trained one way. Maybe one read up on an article and thinks this way. Maybe another one had a few patients that went this way with it, and that's why they think that way. So you have to remember that you might go to one doctor and you tell them, hey, listen, this is what's going on, and they tell you something, and then you go to Dr. B, and Dr. B tells you something, and then Dr. C tells you something totally different. Everybody's different, guys. This is not one of those things that's by the book. That's like, okay, in black and white, in writing, sentence by sentence, tells you exactly what to do with every single patient. By their age, by their weight, this is how it goes. There's a chart. For example, I'm going to give you a prime example. In pediatrics, there are growth charts. On the growth charts, you have your percentiles. In those percentiles, that goes for all the kids. It's regardless. It's textbook. This kind of stuff, guys, is not textbook.
Right.
It's not.
Right.
It's just not.
So, I mean, I want to give you guys a little background on the aromatase inhibitors. Javier, I hope they answer your question. I did see it on there. So I appreciate that question because it's a big question. So aromatase inhibitors are most commonly used and needed. Now, there are some guys, there's always an exception to the rule. That's where the blood test and the way that you're feeling is key. Telling your practitioner, whoever's taking care of your health, or HRT needs to know, be in tune. But once you're dialed in, man, you should be good to go, okay? Jimmy Wheels, what if I'm in a wheelchair and your blood pressure is high? What should I do? Diet would probably be a change. At that point, I don't know how your diet is and stuff like that. Any kind of exercise you can do. Listen, there's plenty of wheelchair athletes out there. I praise them. They're awesome.
Is this somebody that's on hormone replacement?
Are you on hormone replacement? Yeah, that's a good question.
The reason I ask you guys that is because when you're on hormone replacement, guys, just a fact for you, guys that are out there on testosterone, even females that are on testosterone replacement, it can definitely raise your hemoglobin hematocrit levels. Now, when your hemoglobin hematocrit levels do go up, what it does is it doesn't get the blood to where it needs to go on time. This definitely does cut off the oxygen to where it needs to go. So basically, what that can do is cause hypertensive issues.
Right.
So it can cause high blood pressure. So keep that in mind. If you are on testosterone and you happen to be having any headaches or fatigue or high blood pressure, you might want to get a CBC check and see what's going on.
Right. So I hope we've covered aromatase inhibitors for you guys. We can help you guys a lot more with this, or blood testing to see where your estrogen or estradiol levels are at, along with the other hormones and many more other blood tests we can do. All you guys have to do is call or text 727-389-3220. It is Men's Health Month, June. So, guys, I want you to take advantage of it. And please test yourself in all these different things. Also, your liver, your kidneys, your prostate, cholesterol, vitamin D levels. Check those things, too, because they're important, not just testosterone levels.
Right.
Your body needs all these things to work in conjunction to work properly for you. So don't let them break down, and don't let yourself break down, right? So at that point, I want to talk about androgen. So androgen, this was a really cool Titan Titan tidbit, I guess. So androgen, does anybody know where the word androgen stems from? So androgen stems from the word andro in Greek, right? You know, and I'm Greek, so I like to learn like little different things like that.
What do
I
you
really
know?
know that, so that was pretty cool to me. So I mean, a lot of words do stem, from that or stuff like that, but it was really cool. So androgen. So now you guys got something you guys can break out at a trivia game or something like that you guys have. So that's really cool. But androgen. So let's talk about testosterone too. Testosterone gets a bad rap, right? Testosterone, anabolic steroids. You're taking steroids. That guy's juicing. I can look like him if I take testosterone. He's on steroids. That's a steroid. That's a steroid. Guys, for real. All right. We're in 2019, 6 months away from 2020. Guys,
it's becoming more socially accepted.
Testosterone is needed for men's health and female health, right? Not taking absorbent amounts,
uber duper,
crazy, extreme amounts. It's not about that, guys. It's about getting it right, taking the amount you need, and at that point, feeling good and looking good, performing good, guys. That's what you guys should look at. Testosterone gets a bad rap because of some of the things or some of the people that have been associated with testosterone. There's been a lot of myths about testosterone that's been passed around for years and are finally getting broken by medical research and clinical studies. So that's awesome. I'm glad to hear about that. I praise the people that are studying it. But think about it, guys. If we have it in our bodies, it's natural to our bodies. I hear the word unnatural a lot. Guys, unnatural is taking unnatural amounts. Getting a natural range, I do think that's natural if you need it. At that point, then you're natural within normal range, okay? So don't let people give you a bad rap about testosterone. Don't let them tell you it's going to give you prostate cancer. Don't let them tell you it's going to give you heart disease or any problems with cholesterol.
For heart disease.
Like she's saying, it's a preventative. So at that point,
because it helps with inflammation.
You will do yourself justice. I'm from Miami. Do I have to visit the clinic for testosterone therapy? So Javier, the best thing to do is call or text 727-389-3220. The girls will walk you through everything. We can set you up with blood work in your zip code, guys. So wherever you're located at, you can call or text us. We can set you up with blood work in your area, so you can just walk in with this slip that we're going to send you via email after payment. And at that point, you'll go in. They're going to draw your blood. We're going to get the results expedited and back to you, so we can get you on the schedule so you can see medical personnel, or we can send you a copy of results so you can monitor your own health, because maybe your doctors aren't running some of these tests that you want, or you're just finding out about through me, and you want to know where you lie or where you stand. So at that point, you can do that on your own. You don't need, some other primary care that should be working for you, telling you, no, I don't want to test that. What are you testing that for? I just talked to one of my friends. He got testosterone. All right. Well, I guess I'm frozen on Facebook. If I'm still frozen, guys, I appreciate it. I'll end Titan Talk here. I love you guys. I appreciate it. Thank you for tuning in. Listen. Write me the questions. DM me the questions. Write them on here. I'll go do another Titan Talk in the office this week. I promise. Okay, and I'll cover more issues for you guys. And so Instagram, I know, because I'm on here with you guys. So
you got
Facebook,
you guys can write on. You can.
I appreciate you guys. Instagram, I'm gonna stick with you guys. Facebook, I love you guys. Write in the comments. I'll see you guys later this week.